Welcome back to the show. I'm with Time Magazine's Joe Klein. Joe, we were talking about Obamacare, and one of my comments was, there seemed to be a number of very positive points, just in terms of raw politics, yet the president and the administration, to me, just observing this, didn't seem over the past couple of years to do a very good job of simply informing the American people what the advantages were. Am I wrong about that?
No, I think you're right. It's one of the big criticisms I've had of the president. He seems to feel that it's a form of hucksterism, that it's too blatant. And my feeling is that these are really complicated pieces of legislation. Dodd-Frank, the financial regulatory reform, the auto bailout, the stimulus package, and you got to be a little blatant when you're explaining it to the folks.
One area which the Affordable Care Act never addressed, and intentionally seems to me didn't address, was really the cost of health insurance premiums. And Americans across the country have seen their premium rates absolutely skyrocket before Obamacare and after the passage of the act. And right now there doesn't seem to be anything in sight to stop that or slow that down. Was that a fatal weakness of the legislation, or was that just the behind the door deal to keep the health insurance industry from attacking it?
Well, I think that there are some steps toward reform that will be very valuable and that will bring down the cost of care. But if you have a deal where you're going to keep the insurance industry alive, there's a certain price that you have to pay for their cooperation, and I think that price was paid. I don't know how much longer as a society we can continue to afford to pay that price, but there are aspects of the bill that are really important and are going to be really important in years to come, especially with regard to end-of-life issues.
And speaking of that, your special on how to die. Talk a little bit about that, and of course that's a very personal story for you.
Well, my parents met on the first day of kindergarten in Rockaway Beach, Queens, and they spent 86 years together, more or less, except for World War II.
That's incredible.
And they were both suffering of dementia at the end, and I pretty much had the medical power of attorney. They were out in State College, Pennsylvania. And this is something that people our age are going through constantly now. Everybody has a story. And what I found was that the fee-for-service medical system didn't do very much to help me or keep me informed as the person who had to make the big decisions. My parents had a platoon of specialists, none of whom talked to each other, some of whom were prescribing drugs that interacted with the other drugs in a bad way. They had an internist, their personal physician, who was intimidated by my father, which was very easy to do because I was intimidated by my father my entire life. Then my mom got really pretty sick, and I was out on one of my road trips, and the doctor called and said, "We have to put a feeding tube in your mom." And I knew she didn't want that. It was in her living will. But I wasn't there. And my brother was in Asia, and so I gave him the go-ahead. And after that, I moved both my parents into this nursing home. And the nursing home had doctors that came from the Geisinger Medical Group, which nobody's heard of, although President Obama loves this. It serves 2.4 million people in central Pennsylvania, mostly in rural areas. And the doctors are not paid according to the services they perform, the tests and procedures they perform. They're paid according to salaries. They get salaries plus performance bonuses. They also have a very elaborate electronic record-keeping system, and they've been able to draw conclusions out of that about best practices. And what I found was that three things happened immediately when I got to these Geisinger doctors. Number one, they stopped sticking needles in my parents. Number two, they said to me, they don't need to be going to all these specialists anymore. Your dad has prostate cancer. He's not going to live to see it affect him. And number three, they started treating me as if I were a sentient human being, you know, and I became part of a care team that was making these decisions. I wasn't off on my own. I was completely informed all the time. I would get phone calls twice a day. Your dad fell. We're changing this medication. I really felt as if I were part of the team. And when it came to make the final decisions on both my parents, which I made, I was a death panel, I felt a certain amount of confidence along with the sadness. And by the way, this saves money in a big way. And do we have time for me to give you one example?
Sure. Well, I mean, you know, I think it's commonly known the end-of-life costs of medical care are extraordinary. I mean, a third of total costs over a person's life can be incurred in just the final months of his or her life, and that even begs the question of what do all those procedures, what does all that treatment do? The other point you made, which is really significant, is the fee-for-service model, which creates an economic incentive for medical practitioners to order every possible test. And
well, I have a great example of that. When my mom turned 80, she had a heart murmur from birth, and she said to me, it's getting worse, it's getting a lot worse. And I said, how do you know it's getting worse? And she said, well, I don't have the energy I used to have. And I said, Mom, you're 80. But she didn't believe me, and Dad would go along with anything she wanted. And so Medicare paid for her to have a heart valve operation that cost upwards of $100,000.
at the age of 80.
At the age of 80. It took her 3 years to recover from that operation, at which point she had no more energy than she had in the first place. Now, if it had been a salaried integrated care model like Geisinger, there would have been family meetings, a conversation about what the process was going to be like that she was going to put herself through, and what the end result was going to be. But you had some, you know, heart surgeons in New York who made a lot of money off of that. And, you know, I don't mind if Dad was going to pay for it, but to have bus drivers and convenience store clerks being paying for my mom's $100,000 heart operation, I think is fundamentally unfair.
Well, unfortunately, that experience is terribly common.
It's very common.
When we come back, I'd like your thoughts on how do we move from a fee-for-service model, which I think a lot of people say does not make any sense, to a model where professionals are salaried. And actually, except for doctors and specialists, I mean, physicians' assistants are salaried, nurses are salaried, the receptionist, the bookkeeper, I mean, you already have the majority of the people in the medical system being salaried. How do we complete that cycle? We're going to talk about that when we come back with Joe Klein.
Coming up next.
We're about to go through a massive restructuring of healthcare in this country. It was going to happen with Obamacare, without Obamacare, it was going to happen. And we're going to learn a lot along the way. And it may well be that the federal government is going to, you know, provide some of the resources for that.